Hello, everybody. My name is Firoza Haffejee, and I am from the Durban University of Technology in South Africa. My topic for today is on the public health concerns in South Africa through the lens of students. South Africa currently faces a multiple burden of disease. The HIV and AIDS epidemic is coinciding with a high burden of tuberculosis or TB. In addition, there is a high burden of waterborne diseases such as bilharzia and cholera. We also have high maternal and child mortality rates, high levels of violence and injuries, and a growing burden of non-communicable diseases. South Africa also has an unequitable distribution of resources between higher socioeconomic strata and lower socioeconomic strata. This results in many challenges faced by people from lower socioeconomic strata. Adverse environmental conditions also play a role in these health challenges. As part of a module on public health, university students learn about the effect of environmental factors on health. This was previously taught to them. However, a new approach has now been introduced, and this approach gets students to engage in issues of public health to make the module more learner-centered. The aim of this study is to recognize the challenges faced by communities in terms of the environment and how this will affect health. A second aim of the study was to assess the impact of the new teaching method on student learning. So for this module, students were asked to go out into communities and capture photo images of environmental factors that are involved in disease causation. The students were required to work in self-selected groups of 2 to 4 students per group. The groups were required to reflect on the problems faced by the community, discuss their concerns, and how to mitigate them. The project had then to be presented to the lecturer and fellow students in class. Each presentation was limited to a duration of 10 minutes, with a further 5 minutes allocated for questions. Prior to commencing this work, ethical clearance for the study was obtained. The assignment was completed by the entire class, comprising of 42 students. Majority of the photographs depicted the social and structural determinants of health. There was also a large emphasis on pollution. And this presentation engages with some of the data that was presented by the students. This image depicts an informal housing settlement on the outskirts of the city of Durban. The informal housing shows inadequate infrastructure. We see that the houses are made up of corrugated iron walls, which are not closely built together, so there are gaps in between the walls, resulting in adverse weather conditions such as wind, cold, and rain entering into the homes. This insufficient protection from adverse weather conditions could lead to a predisposition to disease. There is also a very close proximity of the different dwellings to each other, which could result in an easy spread of communicable diseases. And some of these are tuberculosis, pneumonia, and other respiratory tract infections, amongst others. The rapid urbanization in South Africa has led to overcrowding and in turn to a lack of resources. And it is this rapid urbanization that has led to a massive increase in the number of informal settlements in and around large cities. It has also resulted in an unequal distribution of resources in the country. The sudden influx of people into the cities forces health facilities to function beyond their capacity, and it adds strain to an already overburdened healthcare system. This may also impact on service delivery, such as waste removal. This picture, which was also taken by the students, is another view of an informal settlement in another area around the city, and it shows cluttered informal settlements which have problems associated with waste removal. And because they do not have waste removal facilities that are provided by the municipality, the waste is disposed of in surrounding areas. What is very concerning in this heap of waste is that there's evidence of biomedical waste, as well as sharp containers. This is very hazardous, particularly to children who may be playing in the area and others who may be walking about bare feet in the area. The waste could also impact on access to water if this waste is lying between the homestead and a river or other water source. This particular picture shows us another informal settlement, which is very close to a water source. And the stream here looks like it is about to flood over. There's lots of rubbish lying around in the surrounding area. And if the stream floods, then all the rubbish is going to end up in the river, which is then going to take the dirt downstream. This particular stream leads into a large river, which is the Mgeni River, which flows out into the sea on the outskirts of Durban. And this is an area very close to the watermouth of the river. And we can see here, after a flood, all the debris that has been deposited on the banks of the river. Please note that there are no informal settlements in this area. So this is waste that has come from a waste that has moved downstream. This particular river, the Mgeni River, is a primary source of water for more than 3.5 million people. Water tests have shown cholera, salmonella, shigella, adenoviruses, enteroviruses, and even rotaviruses at all locations along the river. So all of these can lead to serious disease amongst people that are using the river as a direct source of water. In both informal settlements in the city as well as in rural areas, there is often a lack of piped water and sanitation. Hence, people collect water from streams. And here we see this lady collecting water from a very tiny pond there. And these are all the different water containers that she will be using to collect her water in. This could lead to a predisposition of disease such as bilharzia, amoebiasis, and cholera. The lack of piped water is also highlighted in this particular picture here, which was also taken by one of the student groups. We see people bathing in the river, and this takes place in dams as well as rivers which are close to their settlements. Bilharzia is one of the major problems in the province of KwaZulu-Natal in South Africa, and these people bathing in the river could predispose them to bilharzia. An additional problem is that the waste is often burned, which results in air pollution. And in the words of one of the students, people are coughing all the time. They are unable to breathe. Sometimes they wake up and see ashes in their spit. The intensity of the smell also causes people to feel dizzy. During the presentations, students were required to find solutions to the problems that were faced. And the students found both short-term as well as long-term solutions to the problems that were faced by their communities. Interventions on recycling of waste were discussed. And in this particular project, which is a picture taken of a litter broom project, which some of the students had become involved in, shows us a netting placed across a river. And as the dirt moves downstream, it gets collected into the net. So the garbage here can then be disposed of in the proper manner. The students also highlighted that plastic waste from this garbage is collected for recycling. And it is very encouraging that the students had actually become involved in these recycling projects. Some of the long-term solutions that they discussed were that we require provision of services such as piped water, sanitation, as well as waste removal, and that municipalities need to provide proper housing for all communities. So we can see from this presentation that students responded to different kinds of environmental factors, which could be divided into two large groups. The first environmental group of factors are clustered communities without services, and the second is pollution. These clustered communities without services have a lack of proper infrastructure. There's poor waste management. As a result, waste is discarded outside the settlement or in surrounding areas. And that in turn leads to pollution, and the three different types of pollution, ground pollution, air pollution, as well as water pollution, were discussed by the students. Health risks of pollution have serious consequences. Poor air quality increases the number of health-related illnesses, for example, respiratory diseases like asthma and bronchitis. It also leads to poor water quality, heightens the risk of diuretic conditions. And all of this further burdens an already burdened healthcare system. What about the teaching and learning aspect? This intervention promoted active involvement of students in their learning process. It allowed for creativity and the development of new skills. The students were able to control their own learning from examples that were relevant to their context and surroundings. And it allowed them to become critical thinkers and to find solutions to problems that they and their communities were facing. So in conclusion, the photo illustration is a way of promoting learning and understanding of public health issues. It represents a more holistic approach to learning about community health rather than adopting a teaching approach. And I conclude that it should be continued in the future. Thank you.